Joining me to discuss further is CEO of Leading Aged Care Services, Sean Rooney. Sean, thank you for joining us tonight on Sky News across Australia. Take us through the latest restrictions that the Prime Minister has announced.
Well, the primary concern and focus for the aged services sector is on the health and wellbeing of older Australians in care, and also the safety and wellbeing of the passionate and professional workforce that cares for them. Now, the Prime Minister yesterday had made significant announcements with regards to the escalation of measures that we are to put in place to do exactly what the Prime Minister says, that slowing the spread of this virus will save lives. And what we want to do is make sure that we do that in a way that protects the most vulnerable. And as you've pointed out, that is people who are over the age of 80 or so. And in particular in residential aged care, we need to ensure there's appropriate infection controls that are in place to ensure that infections don't happen.
Now, Sean, there will be no social activities or entertainment permitted in aged care facilities indefinitely, and no large group visits and gatherings of visits for school groups.
Yes, so the Prime Minister made a number of announcements yesterday. These were based on advice to the National Cabinet from the AHPPC. These are the medical professionals advising governments with respect to recommendations of the minimum practices that residential care facilities would need to put in place to protect their residents and the workforce. So many of the minimum practices were already in place, things such as screening visitors with respect to whether they have any of the risk factors for COVID-19 or whether indeed they have any symptoms. But it's now gone a lot further to restrict the access of a number of particular groups. So people under the age of 16 would not be permitted to enter facilities. We know that large groups have been limited, and that what's recommended is that residents would have a small number of visitors, limited to a small duration of those visitations, as we do everything we possibly can to be able to reduce the risk of infection. Now, having said all of that, we know that care and compassion here for elderly Australians who need to have that social connectivity and visitations and connections with their loved ones is of paramount importance for their mental health and wellbeing. And so there's always ways and means and measures that on a case-by-case basis, these factors need to be taken into account to ensure that the care delivered is getting the balance right between compassion, but also vigilance and protection and caution to ensure older Australians aren't exposed to infection.
Sean, let's have a look at some of these measures. We'll get this graphic up now. They're not allowed to visit if anyone has travelled overseas in the last 14 days, been in contact with a confirmed case, had cold or flu symptoms, were not vaccinated against the vaccination, or a child under 16. Those who do visit can only do so for a short period, with maximum of 2 visitors at a time per day. Visits must be in a private room or outdoors, not in communal areas. Social distancing is being encouraged, but there will be exemptions at the discretion of facilities for end-of-life cases. Now, just on those end-of-life cases, Sean, I mean, this is a hot topic. It's a contentious one. And, of course, you know, when you talk about aged care facilities, we are talking about people who, you know, I mean, let's be frank here, are there and in many instances die there. So what happens when someone wants to see their loved one in an end-of-life scenario?
Right, so the guidelines from the Prime Minister have been quite clear that all of these restrictions are in place. They are the minimal restrictions. However, it's at the discretion of the care facility and in conversation with the residents and also their loved ones that there will be a case-by-case exceptions to this rule, and particularly in the case where it's palliative care. I mean, the last thing we want to be doing as a society is denying people comfort and care in those circumstances. And so for anybody in that situation, the approach to take is to have that discussion directly with your residential care operator, with the care home staff and the management, to ensure that the circumstances are fully understood. And as I said, those exemptions will be applied on compassionate grounds where they're warranted.
Sean, you've just been through a Royal Commission into the aged care sector, which obviously had a very exhaustive look at what's going on in that particular industry. Have you seen anything like this challenge that's confronting your industry right now?
Peter, look, residential aged care facilities deal with seasonal influenza outbreaks on a cyclical basis, on an annual cycle. So we have in place the systems, the processes and the protocols to deal with infection control. They're well known, well understood, and adherence and compliance to those is mandated by the Aged Care Quality Standards, and it is regulated by the Australian Aged Care Quality and Safety Commission. So all of that currently exists. With COVID-19, our sector's been on high alert since January this year, putting in place time and time again as the situation has escalated, more and more measures to ensure that people are well trained with respect to proper infection control, that emergency plans in the event of infections are in place and also now being stress tested, that the personal protective equipment that's required to reduce infection and in fact limit infection if there is an outbreak, that those stocks are available and on hand. So there's many things that we've been doing already in addition to the things that we would normally do from a business as usual perspective. But it's fair to say, getting back to your initial point, this is unprecedented. It's unprecedented for our sector, but it's indeed unprecedented for everybody. And what we would impress upon everybody across the community is ensuring the safety of the vulnerable older Australians is an issue of national importance, and it's a responsibility of everybody and not just the aged care sector.
Sean Rooney, thank you for joining us on Sky News Across Australia tonight.